Now, ladies and gentlemen, as you are all there, let's begin the last session, which is on COVID-19. Why did the world mishandle its response to the coronavirus crisis? So we have from the Asia, the United States, as well as from Europe, who have been working on the coronavirus response from the global health perspective. There are 5 of them. I would like to introduce these panelists to you. Dr. Hiroshi Oshitani, Professor of Virology at Tohoku University Graduate School of Medicine in Japan, and ZhiJie, and Dr. Jennifer Nuzzo, Senior Scholar of Johns Hopkins Center for Health Security in the United States, and Mr. David Heymann, former Assistant Director General for Health Security and Environment of the World Health Organization, and also Ms. Margaret Chan, was supposed to be here, but she could not make it in person, so she is going to have her message delivered through the video. Now over to Mr. Kudo. So we have had really in-depth discussion. I'm sure that viewers are enjoying this Tokyo Conference 2021. We have been working on the discussion of how to restore liberal economic order and democracy and international cooperation. This is the umbrella theme. And under this theme, a big umbrella, we would also like to address the issue of a response to coronavirus pandemic. As we have already discussed today and yesterday, and panelists have already mentioned yesterday and today, and this is the question of why is it that the damage has been so extensive? This has been a crisis of humanity, but this world come together. Or rather, each country really focused on its own domestic response. As a result of that, we now see 120 million people infected and more than 2.6 million people have died because of the coronavirus, which is really a dire situation. We haven't been able to be successful in containment of the coronavirus crisis. So, such coronavirus response in terms of future of international cooperation, this provides a very important testing ground for future of the international cooperation. Many have said so. In the past week, we had an emergency survey, questionnaire survey into experts in Japan, and the majority or the most of the people said that if there will be another pandemic in the future, we may repeat the same failure, the same mistake, which means that we are not learning lessons from this pandemic. So that is why I believe that we need to address this very important question. So international cooperation against the backdrop of this pandemic, why is it that international cooperation did not function well? So a global health governance, how such framework of global health governance should be established going forward. What is the role to be played by WHO? How should we position it? So there are many issues we need to address. And today, in order to discuss this issue of global health, we have those expert panelists who are at the forefront of the coronavirus response in each of their home country. We have 4 guests to spend 8 minutes each to give us initial remarks. So what I expect is to address the question of why is it that the damage of the coronavirus pandemic has been so extensive, and why is it that the international cooperation is not functioning, and in order to avoid further restrictions going forward in the future, what are the lessons to be learned from the pandemic this time around? After each speaker's 8 minutes initial remarks, we will be focusing on certain specific questions to deepen our discussions. So first, without further ado, I'd like to introduce an expert from Japan side. Dr. Oshitani has played a central role in our response to coronavirus here in Japan. He is professor of virology at Tohoku University Graduate School of Medicine, Japan. So Dr. Oshitani, over to you. Dr. Oshitani, you are muted.
Sorry, I'm going to speak in English. Thank you very much, Kudo-san, for introducing me, and also inviting me for this important session. I used to work in a WHO, and I was involved in response to SARS outbreak in 2003. At that time, David Heymann, who is also the panelist today, was working in the WHO headquarters, and I was working in the WHO regional office in Manila. And actually, this virus, the SARS-CoV-2, which is causing the COVID-19, is much more difficult to control than the SARS coronavirus. But as a former WHO staff, I'm a bit frustrated with the WHO response. And I'm going to mainly talk about why WHO is not functioning well for the COVID-19. And as you all know, we are now facing to the unprecedented and the significant global challenge in 21st century, posed by the COVID-19. And over 1 year has passed since the WHO they announced that the COVID-19 was considered pandemic on March 11 last year, and many researches have been conducted, and some promising the vaccines and antivirals have been developed. However, still the number of cases and the deaths is climbing every day, and there is no concrete solution for this challenge. And all countries in the world are still struggling to find a way to minimize the impact of COVID-19. The Asian countries, including Japan, have been implementing different approaches for COVID-19. And the impact is relatively small in Asian countries when compared to the Americas and Europe. I believe that it is crucial to share the lessons and the good practices between countries. In the past 1 year, I have attended several dialogue sessions with other countries, including ones with China and South Korea, organized by the Genron NPO, which is the organizer of this the session. And this kind of exchange is supposed to be coordinated by WHO. And I do believe that the WHO is the most important global body for the public health crisis, such as a pandemic. However, unfortunately, WHO is not functioning for COVID-19 as expected. I think there are several reasons for this. The first, WHO is supposed to be a technical agency, but it cannot be free from the political influence from member states. When we discussed with the Chinese colleagues in the dialogue session organized by Genron NPO, Margaret Chan, the former WHO Director General, rightly said that the WHO could not do much without support from member states. And it is true that member states have not provided full support to WHO in the past year. And second, WHO usually provides support mainly to low and middle income countries with technical and financial support from high income countries. But this framework doesn't work for COVID-19. Most high income countries and emerging economies that have been supporting WHO in the past decades are being severely affected by COVID-19. Actually, the impact of these countries, the high-income countries and the emerging economies, are having a much more impact than the impact in the low and middle income countries. This is probably unexpected scenario for WHO. And lastly, the WHO clearly doesn't have enough resources, both human and financial resources, to respond to such huge global challenge. The COVID-19 pandemic is much bigger and much more complicated than any other the previous outbreaks of global concern. WHO alone cannot address all challenges posed by the COVID-19 pandemic. We urgently need to develop the better global health governance system. But this has been discussed even before SARS outbreak in 2003. And but this is still unsolved agenda, and all countries should work together to address this issue. And thank you very much for your attention.
Thank you very much. So next speaker is Ms. Jennifer Nuzzo, Senior Scholar of Johns Hopkins Center for Health Security. I read the paper in Foreign Affairs. That's why I asked her to participate in this session, and I'm very pleased for her participation.
Thank you so much for that kind introduction and for the opportunity to speak to you. It's really a privilege to join you all. My colleagues and I at Johns Hopkins have been tracking the COVID-19 pandemic since really it began early last year. And what we see is that as of today, there are more than 123 million cases that have been reported by 192 countries across the globe. I would just want to pause there and acknowledge an important accomplishment. The COVID story is clearly a bleak one for the most part, but there are some areas of success that I think it's important for us to acknowledge. And the fact that 192 countries have been able to report a completely new virus, to find and report a completely new virus, is an important accomplishment that I think that we should acknowledge. And clearly, this took much work from the WHO and the work of these countries themselves. And so I do think we have to acknowledge some of that success, and really, a lot of credit goes to those organizations and countries involved. There's, of course, bad news, which is that as of today, more than 2.7 million deaths have been reported worldwide. And, after we saw a very welcome period of decline in cases across the globe, we are now unfortunately seeing the virus surging back in multiple parts of the world. So that leads us to the question of what went wrong. And when it comes to the topic of what countries did right or what they did wrong in responding to COVID, it's tempting to try to compare them on outcomes, deaths, cases, case fatality. But these very crude analyses can be quite misleading. In our efforts to track global COVID cases at the Johns Hopkins Coronavirus Resource Center, we've seen firsthand the disparities in countries' data, different and changing case definitions, different approaches to diagnosing infection, different approaches to labeling positive tests as cases and deaths, different approaches in testing people who have died. And so this lack of global standards really hinders our ability to make these head-to-head comparisons between countries on outcomes alone. This is not surprising if you've worked in this field, but I think folks outside of public health maybe have a bit of a misunderstanding of how the integrity of the data. Nonetheless, even with these shortcomings, I think it is possible for us to look at countries and try to understand what actions they've taken that have worked well for them and what actions haven't worked well. Shortly before the world woke to the pandemic situation, my colleagues and I at Johns Hopkins, the Nuclear Threat Initiative, and the Economist Intelligence Unit published the first ever Global Health Security Index, which benchmarked the health security capacities of 195 countries. We published our first report in October of 2019, so just a few months before the pandemic started. And what we found when we put all the data together was that no country was fully prepared for a pandemic, much less one at this scale. all countries lacked critical capacities and possessed important risks that could hinder their abilities to respond to a public health crisis. The Global Health Security Index scores were not correlated with country income, but it was perhaps not surprising to see a number of high-income countries like the United States and the United Kingdom score near the top. In fact, the US and the UK were the two highest scoring countries. So of course, given how poorly these two countries in particular have fared in their response to COVID-19, it raises questions, how should we interpret that? Does that mean preparedness, planning, and public health capacities as what was measured in the index are not important? I don't believe so, and neither does the International Panel of Experts that advises us on the Global Health Security Index. But in our analysis, what has become clear is that having these capacities, as we say, there's a phrase that we say in epidemiology, is having these capacities is necessary but not sufficient. So what didn't countries do? What was not sufficient? There are a few key areas to look at. I think of them in sort of five bins. The first one is when countries did not fully avail themselves of the capacities that they have. So if you think of public health capacities, it's probably helpful to think of them in terms of a fire protection system. When the alarm goes off, you use the lights and the signs to help you find the fastest and safest path out of harm's way. Having a fire protection system, having public health capacities can save lives if you use them as intended. But if the fire alarm goes off and you choose not to move, you choose not to leave the building, or you're very late to leave the building, or you ignore the signs, things may not work out as they should. And so what we've seen in response to COVID is that countries, actually notably the United States and the United Kingdom, did not avail themselves of the capacities they have. In a number of instances, we saw countries rely almost exclusively on travel restrictions in the hopes of keeping the virus out, but at the complete expense of domestic preparedness, so that when the virus would eventually be found within these countries' borders, that they would have plans and were ready to either contain it or to mitigate its spread. The other area that we saw as being contributing to the insufficiency of the response was responding through poor risk communication and, in many cases, politicization. So it's been now reported that the leadership of several countries chose to respond to the threat of COVID-19 by downplaying the risks. It is a common tendency, as if you've studied these events over time, you see it's a common tendency for inexperienced leaders to want to react by be overly reassuring. That is something I think should be expected to some extent. But what we saw in the response to COVID was more than just an initial missteps, but really, a concerted and sustained effort to try to deceive and deny the magnitude of the threat. In some countries, it's become politically advantageous to debate the harms of the virus. And this has really been unfortunate because it's served to exacerbate the social divisions, which having social cohesion is also helpful in a response to a pandemic. But when political leaders have tried to exacerbate social divisions and, in their own language, promote lack of adherence to public health measures, that really does not equip the country for a swift and efficient response. The third area where we saw failures was really in understanding and appreciating and readying the broader health system. This was one of the findings of our Global Health Security Index. Actually, for me, it was one of the starkest findings, was just how weak countries' health systems were. It was the area of our index where countries, including the United States, lost the most points. And the consequences of that became quite clear in the spring of 2020, when many countries found themselves under lockdown out of an acute fear that their health systems were going to be overwhelmed by a surge of infectious patients. And so really, I think this crisis should cause us to take a hard look at how ready health systems are in order to respond to public health crises. And I will tell you, many of efforts that have been ongoing to strengthen public health capacities at the national level have not been sufficiently inclusive of health systems, the health clinics, making sure that there are enough community health workers and doctors and nurses. There'll be efforts to, in global health security capacity development, to equip laboratories, which is important. But if you don't have clinicians who are able to take a specimen and send it to the laboratory, then that laboratory will not be as useful. So we really need to integrate what have been previously disparate fields of health system strengthening and the field of preparedness, and to make sure that they are working in concert with each other. The fourth area of insufficiency was failing to address the economic harms of the pandemic, and in particular, pursuing restrictions over resources. So we know that many countries have responded to the pandemic through the use of restrictions, lockdowns, closures, other things. In some cases, these restrictions have been quite broad. And while it may be necessary in the face of a rapidly accelerating epidemic for which there are little alternatives, doing that for a year is quite difficult and perilous in its own right. We have seen deep social divisions due to the loss of income and the loss of liberty as a result of these restrictions. And we also know that the restrictions aren't sufficiently protective in the sense that there are still essential workers who are going out and becoming infected. We also know that people's abilities to stay home and take protective measures are usually income dependent. And so countries I think that have been more successful are ones that understood that economic dimension and provided social support for people who were subjected to public health interventions, to enable people to stay home, to allow people to comply with public health recommendations. But unfortunately, there are also a number of examples where that wasn't appropriately done. And what it in many instances did is just exacerbate some of the inequalities that have existed, such that you see a protected class who is able to stay home and work from their computers, and a working class that has to continue to go out and continue to be exposed in their workplaces and when they're out. And so this, I think we have to understand that it's not public health or the economy, it's both at the same time, and that they're both critically important to an overall effective response. And then finally, the last area where there's been deep deficiencies is in the clear tendency towards nationalism over pursuing global approaches. The Global Health Security Index measures national capacities. It doesn't measure what exists at the international level, but clearly international coordination and cooperation are essential for the response to global pandemics. Unfortunately, what we've seen is really nation by nation competition for resources, initially personal protective equipment and medical supplies. And then when other things like vaccines become available, we see deep disparities in terms of which countries have been able to acquire vaccines, which countries even have access in the first place, and how many vaccines countries have. It's probably unsurprising that these disparities fall along income lines, which, if they're allowed to continue, will only further exacerbate income disparities across the globe. Now there's a lot of conversation in countries with vaccines about the potential use of vaccine passports. Discussion about, can we get back to normal if we have some proof that you've been vaccinated? And this is, in my view, a clearly ethically fraught proposal, and it's one that I think the global community really needs to weigh in on, because it has the potential to completely reinforce these income inequalities and exacerbate disparities. But additionally, it's also the wrong answer to the question of how do we get back to normal and how do we get back to safe? The answer to that question is we control COVID and we get countries protected against COVID. And that's not going to come by some countries hoarding vaccines and others not having any, and just allowing passports to decide who can move about the planet and who can't. So I'll end on that note just to say that I think there's much more work that individual countries have to do, as well as the globe needs to do, in order to be ready for the next event. I don't view COVID-19 as a once in a century threat. The conditions that gave rise to COVID-19 are ever present, and we could easily find ourselves in yet another situation, or possibly a worse one, in the future. So it's critically important that we examine how things happen. I don't want us to create a COVID response system. I want us to create a flexible response system. We don't know what the next threat is going to be, But I think some of these capacities and some of these global frameworks that are needed will be broadly useful. And I do hope that we can make some progress on it ahead of the next event. So thank you so much.
はい、どうもありがとうございました。今、なぜここまでコロナの被害が広がっているのか。
Well, thank you very much. So, why is it that the damage of coronavirus has been so extensive? And she's presented a lot of discussion points, very interesting ones we will address later on. Now, I'd like to invite Mr. David Heymann, as Dr. Oshitani has pointed out. And Dr. Oshitani really wanted Dr. Heymann to take part in this session at Chatham House. He is a special fellow. So, Dr. Heymann, the floor is yours.
Thank you very much for having invited me. It's a real pleasure to speak and to follow the two previous speakers, especially Hitoshi, with whom I did work, as he said, closely during the SARS outbreak in 2003. That outbreak was a very unique outbreak because there was a global solidarity that the world had really not seen before in responding to this outbreak. And as Hitoshi said, there were also some differences in the virus that caused that outbreak as the virus today. But what was more important was that this SARS outbreak in 2003 was a wake-up call, and a wake-up call for many different things. And one of those was to revise the international health regulations. Though the process had been started earlier, it really picked up speed after the outbreak. And the revision of the international health regulations understood that global solidarity might not always be possible. And the recommendation was the first and most foremost recommendation and change from the previous regulations was that the responsibility to prevent international spread was laid on countries. Countries were expected in this treaty to develop the core capacities that would permit them to detect rapidly, respond rapidly, and prevent the international spread of disease. This was the major change from the regulations which had existed previously, which attempted to stop disease at borders by a series of measures which were realized not effective as the SARS outbreak came along. And in addition, the former regulations covered only a few diseases, not all public health emergencies. So that revision occurred. Countries were expected to develop their core capacities and were provided with an evaluation tool which they could do that. The problem was that the development agencies never came behind the countries and supported them in their development activities, and many countries didn't really engage and really develop those capacities either. And as a result, we see a world that was vulnerable to another outbreak and pandemic when it came. During the pandemic, I would argue a bit that WHO didn't do its job because WHO is two parts. It has a political arm, which is the World Health Assembly, which elects the Director General, which identifies resolutions and priorities moving forward, but that doesn't do the technical activities. Those technical activities are done by a technical arm, and that arm has worked perfectly during this outbreak, as it did during SARS. I chair the Strategic and Technical Advisory Group on Infectious Hazards to that program, and I've seen that WHO has pulled together people from all countries despite geopolitical concerns and tensions. China, the United States, other countries around the world have freely shared their information with WHO through this advisory group and others, and rapid understanding of the outbreak has occurred because of that. So the technical arm of WHO is worked as it always has worked and as it should work, protected from the politics by and the political body that makes the decisions on the priorities and on the Director General. In that advisory group, early on, we felt that this might be a virus which could be contained, as had been SARS coronavirus. But in the end, we realized very rapidly that this, as Hitoshi said, was spread in a different way. It was spread very easily. It wasn't deep in the lungs. It was high in the nasal passages and spread very easily. So responses have varied. And those countries in Asia that had had SARS and MERS outbreaks, rapidly after the 5th of January, when WHO announced this new disease, rapidly put in place detection systems. And by the middle and end of January, we're already containing outbreaks and not permitting it to spread into the community, as occurred in countries which just watched it occur and didn't do that contact tracing, that investigative research, such as in Japan, where it was known that nightclubs needed to be shut down immediately. And also the information that came out of Japan that this disease was not spreading like influenza. It was stopping off in clusters that could be contained. And so the responses were varied. One response in Asia, a different type of response in some European countries. In others, you had a different response with no real procedures in place, just putting the responsibility on populations. And then in Latin America and the Americas, yet a different type of response. So there's been no solid response, and there's been really no way that countries have wanted to work together. And I have to defend countries to a certain extent because governments are elected or in place to take care of their populations, and they must do that. But they must do that in a way that doesn't cause harm, and that's where the difficulty has come in. They've done that by hoarding vaccines, hoarding other equipment in their countries, and not sharing with the rest of the world, which they will begin to do now, I'm confident, and hopefully they will as the COVAX facility and the ACT Accelerator continue to gain importance. But we need to make sure moving forward, it's not too late, that we all do work together. All countries do have a national obligation to protect their people. They also have an obligation internationally to do no harm, and when they can, to provide support to facilities such as the ACT Accelerator and COVAX facility, making sure that there's more equitable distribution of vaccines, of therapeutics, and of diagnostic tests. So I would say that the world maybe has mishandled, but there's still an opportunity to handle it in a way that everyone can benefit. Thank you very much for having invited me to speak.
Thank
you very much. So we would like to discuss on those points that was raised. And the next is the Mr. Zheng ZhiJie of Peking University. And long time no see, Dr. Zheng, and I'd like to thank you for your participation the other day too. So the floor is yours, sir.
Thank you, Kudo-san. So nice to see you again. And hello to fellow panelists with David, Jennifer, and Professor Oshitani. Really, I listened carefully to what you have said. I agree totally with everything that you have mentioned about the reason behind the failure in global health governance in dealing with the pandemic. Well, just as David and Hiroshi mentioned, that I was a CDC epidemiologist in 2003 when the SARS occurred, and was sent dispatched by US CDC to Beijing to help address the SARS as part of WHO team. And I had a wonderful time working with a team of epidemiologists from Japan, from Korea, from Germany, and other countries. So this is an occasion you can see the global solidarity that what David just mentioned. And but during this time, the pandemic, certainly I feel that we do not have this kind of a solidarity and working together by international team or international group. And as a matter of fact, this afternoon I taught a class in for graduate student in global health governance. And so I posed exactly the same question that Kudo-san posed for this evening's discussion. So So, well, I get some opinion from my students, and let me just run down a few things that is quite relevant to what we are discussing here. The first issue was that leadership or lack of leadership is really a big reason behind the global failure. This leadership, we see that WHO actually has to take a very strong stand, but the leadership, that the lack of the usual leadership from such countries such as the United States and other leading countries is obvious. In the past, while you can see that US CDC and other global leaders in global health leaders, it's pretty much is all over. And but this time, personally, as a former CDC, and I feel that I'm very frustrated and dismayed with CDC's performance during not only domestic but internationally in this pandemic. So this is a thing that from this pandemic we can see that there's a huge leadership vacuum in the entire process. Of course, this is much due to the political issue that we all know. A second issue raised by my student, and I agree that I need to mention that there's a lack of trust or mistrust or other thing. This trust was between member country and the WHO, or country between countries, and mistrust between a politician and the scientist, and the mistrust among peoples. So such a mistrust really hinge the effective control and contain of a pandemic. Third thing I think that is also relevant is a resource issue, really related to WHO's capacity in terms of address the global pandemic. And as David and Jennifer and Hiroshi mentioned, that the WHO is a coordinated agency. Of course, in the past year, we will see the huge resource problem, the financial problem. So this kind of resource problem really hinge the WHO in effectively address such a global crisis like this COVID-19 pandemic. And the fourth issue, certainly underestimate the risk of COVID-19. I think this is much to do with a political leader and the scientific community to really educate the community and the population about the risk. And this conflict information and misinformation, the disinformation really has a lot to do with the confusion in the population about the nature of disease and the risk of disease. And even when there's so many deaths and cases, still people feel that this is nothing, and this is something that they will have to worry. And our young population sometimes they really play with seem like they play with their life on that. And the other issue, of course, was for example the sovereignty over international collaboration, and ideology over science, and the competition over collaboration. And this type of thing it's all over, and we see again that all the blaming games and other issue that we see in the media, in the in public speeches and in others. So some of these, I think that really at least contribute to a problem that when a global need strong leadership, and then really need all the population need to mobilize to address this global crisis. I think that those issues will need to be addressed, and when we move forward, particularly post-pandemic, and the system, the global health governance system, and need to form across international health regulation, and we need to have a good review on how this really works in this situation. So I look forward to continue further discussion, but the discussion and this forum, I think this is really important, and global community really need to work together and in a post-pandemic, and when and I really hope that we are closing to see the end of the tunnel, and really look forward to the productive and global collaboration to address all these issues. So thank you again, Kudo-san, for the invitation to participate in this session.
Thank you very much for that. You have mentioned some of the reasons why this response didn't work. And I think this gave me an idea how to wrap up this session. But the discussion points, I'd like to invite Ms. Margaret Chan, who has sent us a video message. So let's listen up to that video message first, and then have a...
Excellencies, ladies and gentlemen, good day to all of you. I thank the organizers of the Tokyo conference for the invitation to this important meeting. The COVID-19 pandemic is unprecedented in human history in terms of its speed, scale, and severity. No country has been left untouched, and our hearts go to the families and friends whose loved ones have been affected. The pandemic is still raging ahead. By March this year, it has caused more than 120 million cases with over 2 million deaths, and the number is growing. In a globalized world characterized by profound movement of people, goods and services, economic and electronic interconnectedness, the traditional defenses at national borders cannot protect people against the invasion of an invisible disease. Our vulnerability is universal. International cooperation is the only way to tackle a common health threat like COVID-19 pandemic. The pandemic has exposed the weaknesses of our health system's preparedness for early detection and response. It has caused havoc in every country and every sector. It has caused disruption in our lives. The pandemic is aggravating other diseases, delaying the implementation of the SDG goals, deepening poverty and inequality, especially in women and the poor. The pandemic has also exposed the deficiencies of global governance. With the United Nations at its core, the UN actually is a platform for international cooperation to deal with global issues. When countries respect science, when countries come together and cooperate, we have seen successes in tackling global challenges like the global financial crisis in 2008, the Ebola outbreak in West Africa in 2014, and the Paris Agreement on climate change in 2016. However, when science is ignored or politicized, as in the case of COVID-19 pandemic, the virus does not go away. It is exploiting the division and the mistrust of people and causing havoc in our social, economic, and development systems. I have to say, in the midst of this darkness, we deeply appreciate some heroes heroes leading the fight against the pandemic. And they are, of course, our healthcare workers worldwide, the community workers, and the scientific community in research and development. We thank them. We thank them for their professionalism, dedication, and sacrifice to saving lives and to giving us the tools to fight the pandemic, like the COVID-19 vaccines. Now the top priority for the world is to work together to control the pandemic. Vaccines are in short supply. Its equitable distribution, especially to developing countries, is consequential. The pandemic won't be controlled until it is controlled everywhere. Friends, ladies and gentlemen, the pandemic has shown beyond doubt that there is no social, economic, and even political resilience without strong health systems and effective international cooperation and coordination. I would like to suggest 2 areas for urgent action in the post-pandemic era. Number 1, to strengthen national and global health security to protect our common vulnerability. Countries must commit to long-term investment in building resilient health systems based on primary health care to protect people, and to enforce preparedness capacity to detect and respond to new and emerging infectious diseases. Public trust and cooperation are essential in any effective control of health threats. Second, to improve global governance in our interdependent world to ensure human safety, security, and sustainable development. In the 75th session of the United Nations General Assembly in September 2020, countries have agreed that solidarity and global cooperation is the only way for defeating the virus causing the pandemic and achieving recovery in the economy and other areas. Going forward, 2021 is the year of opportunities for the multilateral system. And I really hope, and I join the people of the world to expect to see genuine and positive changes in our institutions and systems of global governance. Thank you.
はい。どうもありがとうございました。
Thank you very much for that. So we have just heard from 5 panelists about why is it that the damage has been so extensive and what is the structural problem there. So let's dig deeper into those questions. So as has been explained already, we asked the same question to around 200 experts in Japan. Why is it that the damage has been so extensive? And the biggest answer is that in many countries, the government response failed. That is why the damage has been so extensive. More than 30% of the people said so. And then others said that WHO as a technical agency was not functioning well. So because of the political reasons, WHO was dysfunctional. And as has been pointed out by Professor Oshitani, the United Nations as a system which depend on member states within the geopolitical conflict could not come up with effective measures of response to COVID-19. And then we have division between the United States and China, for instance. This has been a problem as well. And as Professor Oshitani has pointed out, the existing international governance had the United States and the United Kingdom as the leaders, and those advanced nations actually aggravated the situation this time around. So this means that the structure of the international cooperation, and as one of the functions of that, whether it is the WHO or the United Nations, have been questioned here. And also there is a question about domestic responses of each country. So as for the domestic measures, I would like to ask you a question. I would like to begin with this question of about this pandemic. Each country wanted to contain the virus, the spread of the virus, and then with that in mind, they made a variety of efforts. But if you look at the consequence, some of the political leaders underplayed the threat of the COVID-19. Crisis communication was not in place, and also overall risk management was not in place. So there are several problems there. So how can we address those issues going forward? So domestic response being a problem, how do you evaluate that? What are your thoughts there? And in relation to that, and in the previous sessions, we've already discussed this. So there's been a big difference in response between democracies versus authoritarian countries. I'm not talking about the difference in terms of systems, but when it comes to risk management implementation, did it work effectively in democracies? Probably not. That's been pointed out. And it has been discussed already. But if you look at the consequence, there has been an overwhelming difference. So these are the two issues I would like you to address to begin with. First, well, you can actually use the raise hand function if you like, but I would like to actually appoint some of the speakers there. And please follow the 3-minute rule. So Professor Oshitani, what were the problems in terms of domestic responses?
In terms of domestic response, also in Japan, we are having a number of problems. Our initial response was a bit slow, and our PCR capacity and some other capacities were quite limited. And there is also the tension between the technical expert and the politicians, as we are seeing in many other countries. And but still, we are trying to find the best way to minimize the impact. And to some extent, we've been successful in the reducing the impact in Japan. But as I mentioned, there are still many issues, and all countries are facing to the many different challenges. And the pandemic is, as I mentioned at the beginning, they're very complicated and much more difficult to control. And so all countries are still struggling to find the best way to control this virus. And also another big challenge is how to balance between the control of the virus and the sustaining the economy and the society. And so we are still facing the big challenge in this for this one. And I'm sure it's the same in all countries. And this is very, very complicated virus, and the very challenging virus. And that is one of the reasons why the many countries are failing to respond to this virus properly. Thank you.
はい。ちょっと押谷さん、今の話。
Professor Oshitani, I have a follow-up question to that. So you spoke about the tension between politicians versus experts. What do you mean by that? And another thing is about the balance between human lives vis-a-vis economic activities. The healthcare professionals, is that their responsibility to strike the balance, or is it their responsibility to save people's lives and the economic activities should be taken care of by the government and the politicians? What do you think?
With regard to the tension between experts and politicians, we do have such tension, but they all at the same time we are working closely. That we are discussing a number of issues, and in today's opening session, the Minister Nishimura addressed the conference, and I've been discussing with him for a number of occasions, almost every day. And we are trying to find the solution and between technical experts and the politicians. And also with regard to the balance between economy and the suppressing the virus, it is quite a difficult issue. But from the beginning, actually, we set the goal for the COVID-19 response in February, the end of February last year. So our objective for COVID-19 response is to suppress the transmission of the virus as much as possible, while maintaining the social and economic activity as much as possible. Our goal has not been changed. And as the public health expert, we are also we should look at the how to maintain the social and the economic activities. And in the expert panel, we are always discussing how to maintain the economic and the social activities. And that's also because that is also our goal for the COVID-19 response. Thank you.
Thank you very much. So now I'd like to ask Mr. Heymann. So about the domestic response, what went wrong in terms of domestic response?
Thank you, Chair. I think the first thing to really think about is that this virus is a selective virus. It selects out those who have obesity or comorbidities, and in them it causes more serious illness. So countries clearly that have more obesity and more serious comorbidities will be the countries that have the most difficult time dealing with this pandemic. And as evidence becomes more and more available, it's clear that countries like the United States, the UK, and many Latin American countries with increased obesity among their populations, and at the same time comorbidities, are the countries that are having a much greater difficulty in dealing with the virus than are some other countries. That's not to say that all countries are not having a difficult time, because they are. But those countries with comorbidities and obesity in greater numbers have the greatest challenge ahead of them. And we've seen that in the figures that WHO reports regularly. So that's a factor that countries, that is influencing the national response. However, that national response has been, as Hitoshi said, very difficult because the political leaders and the public health leaders in many countries have a very difficult dialogue. And political leaders many times are dominating, showing their populations that they can do what's necessary to protect them. And that may be, in the end, another downfall of the response, in that by forcing physical distancing, rather than helping populations understand how they can contribute by doing it themselves and by doing their own risk assessments, maybe taking away from populations that responsibility which is necessary to really deal with the outbreaks in the way that is best. We've seen that the economies in Asia, which are many times more homogeneous than economies in Western countries, have had probably, at least until the present, the best responses. They responded early, they've continued to respond, they've had a solid response among their populations, and much of that has been because the populations are doing what governments have told them to do and are doing their own risk assessments in many issues. In countries like the UK, the government has decided when the risk is great, and then it shuts down, forces physical isolation. And then when economies open up again, especially in the UK, the US, they don't keep closed the areas where transmission is occurring. Instead, what they do is move ahead and let everything open at the same time. So there are lots of lessons to learn about the national response, but Asia, which has kept its transmission sites closed down throughout the period, have done a much better job in many ways than others. Whether that's more authoritarian or not, I can't answer. Thank you.
Hi. ジェファニー
Okay, what about Jennifer? The United States has had so many deaths, but still politicians and other people tended to underestimate the risk of threat of this virus. And when it comes to the relation between the experts and the government, the politicians, what about the voice of the experts who warned against the risk of the virus and were their voices not heard? What was the problems with the national response?
Yes, I mean, I agree with everything David just said, and I think many of his response applies to this question. I mean, first of all, when we talk about political leaders underestimating the virus, maybe that would suggest that they just didn't know. But we do have some good evidence at this point that that wasn't the case, that it was a political strategy. Why the political strategy was pursued as opposed to one that would avail itself of the resources of the country, I don't fully know. I don't think it was a winning political strategy, possibly as the outcome of the U.S. election would suggest. But nonetheless, it's one that's repeated, and we continue to have political leaders openly debating things that have been generally settled by the science. In terms of whether expertise, whether there's been access to expertise, I mean, I think generally there has been, but there's been a selective pursuit of an expert, in quotes, who would provide the answer that the political leader wants to hear. Which, again, that's a calculated decision. It's not an accident. And so, that's why I think I'm a little bit cautious about over-interpreting from the COVID experience without doing so through an intensely political lens, because it's not clear to me that were this same pandemic to occur to any prior U.S. administration or any subsequent U.S. administration, that it would have unfolded similarly. It does feel as though the political dimension has been an unfortunate poisoning in the overall response. That said, I will say that there have been some areas for which there have been legitimate scientific debate. And I feel that one of the shortcomings has been inadequate opportunities to have those scientific debates. I won't say behind closed doors, but perhaps not over public spaces like social media. And I think that some of the debates that have been happening over social media, while important that the debates are happening, are playing out before the information can be vetted to the general public. And that is perceived then as, well, the scientists just don't know, as opposed to this is what science is. It's the continual gathering and reassessment of evidence in order to pick a path forward. There have been no opportunities in the United States really for there to be an external body to weigh in on the US response until most recently. So what you have is that people are, waging science through op-eds and through Twitter, which, it's important to get the ideas out there, but I'm not sure that's the correct venue for doing it.
Hi,
Thank you very much indeed. But now going to Dr. Zheng of China, and then I think what he's going to talk about we will ask all other panelists for their response. The Dr. Zheng says that probably thinks that China thinks that there is a best practice already in terms of how to respond, because if there is a new emergent virus, then you have to detect it early, and then at early stage identify identify the channels for transmission, and then test all of those people and quarantine them rigorously and provide them the appropriate medicine. That's what you were saying. You said that it's not the matter of the political system, but the question is whether the government has actually done that or not. Is my understanding right of what you are saying? So the question is whether the government actually implemented such best practice that is needed in response.
This is a very good question. Obviously, very early day, while China was the first country hit by this virus, and I think that this virus is really very, very smart in exploring the weaknesses of a human being. But in the early days, without knowing anything about this virus, and China has really experienced some issue, and but this probably will occur in any society or any country. But as soon as while we identify the virus and see the potential harm to human health, and certainly the government swift response to Wuhan early outbreak, I think really making a huge impact on the pandemic in China on the first 3 months of this year. I think that as infectious, particularly respiratory infectious disease, and we all know that this is a common practice among disease prevention and control themes, not purely the Chinese practice. Rather, this is a common practice, common clinical or disease prevention practice. But I think that over the time and after China will contain the outbreak in Wuhan, and China will implement very strict social distance and other measures for domestic and also for controlling the imported cases. And my own experience, I just came back from United States and just complete my 14 days of quarantine plus 7 days home quarantine plus another 7 days for quarantine in Beijing. So total of 28 days of quarantine. And I really keep my eyes on this issue. And first of all, I think that all the people that we came together from the same flight from San Francisco to Shanghai, people was very compliant with what the measure has put in place. And secondly, I think that the local government has really take this very seriously. So accountability is something that every level of government is really and the entire process sometimes is very lengthy and tiring, but people are cooperating. So I think this is really something that need both collaboration between the individual and also with government. But after 28, sometimes I feel myself, and I have been a very cooperative, but my patience also run thin at the end of 28 days. Really, this is a very difficult situation, when every day I got a call from a local neighborhood person and asking about your situation, and every week and I have to go to get my test. So this is really something that I have a personal experience. This is really whether there's any scientific works or not, I don't know. But certainly,
Professor Zheng, please try to finish your remarks.
Okay, yes, I'm
大丈夫ですか？
fine with mine.
はい。
Okay, thank you.
ちょっと今、この、
Right. So I would like to ask Mr. Oshitani and Mr. Heymann, the best practice in China, that's been there already because this is a universal best practice in response to respiratory disease or infectious disease. What I heard from people from Vietnam, when WHO did not recognize this as a human-to-human infectious disease, but Vietnam already put a ban on the people coming from China. There was a much pressure coming from China, but with this border control, Vietnam only has 20 or 30 death cases until now. They were successful in creating this environment. So this is another best practice case, I think. So Professor Oshitani, as Dr. Zheng said today, for such a respiratory infectious disease, viral disease, such best practice, could it be shared universally? Dr. Oshitani, you're muted.
Thank you very much for your question. As David mentioned, this virus is very, very tricky virus, and it's very difficult to contain this virus. But as the China, Vietnam, and some other the countries' experiences clearly showed that it is also possible to control this virus, or even the containment is possible if the very aggressive measures are implemented. But in many countries, including Japan, it's not possible to implement the very, very aggressive measures. Our law in Japan does not allow us to implement some of the measure like a lockdown. And so that's why we are still struggling with this virus. But it is important, as I mentioned in my presentation in the beginning, it's very important to share the experiences and also to share the best practices. And we still have a lot to learn from other countries. And but there are not so many. The David is chairing the expert the board, the WHO. But this kind of the exchange of experiences and the best practices, the very, very important and crucial to control this virus. And but the WHO, as I mentioned, the WHO should take the leading role in coordinating these exchanges between the countries. But I don't think WHO is taking that kind of the leading role in coordinating the between the countries. Thank you.
So, Mr. David Heymann, I would also like to ask you a question. So what Professor Oshitani is saying is that WHO as a technical agency could not fulfill its role and responsibility. Is it because of the political pressure? How do you see this?
Well, you know, best practice will differ in countries depending on what their strategy has been. The best practice, for example, in Australia and New Zealand is to keep the virus out as well as in China. Yet everyone else realizes that this virus is becoming endemic, and it will likely become endemic in these countries eventually as well, despite the fact that they will begin to vaccinate their people. There really have been differing strategies. So best practice that might be useful in Australia now is not the best practice that might be useful in the United Kingdom or in Japan. The disease will become endemic. Countries will need to learn to live with this, and countries that have blocked it or suppressed it completely will need somehow to get their populations vaccinated to the maximum. And then eventually they will have to open up their borders, and it's likely that this virus will enter in some way or another. population immunity may be lower in those countries than in countries where it's been circulating more freely, but we'll have to see as goes on. So best practice can't be universal. It will have to be a best practice for different types of situations. At the same time, regarding Vietnam and that very important observation that you've made, indeed, Vietnam did respond early, and it's been very difficult for me to understand why, when the 5th of January, WHO notified every country at the same time through the IHR focal points, why some countries heightened their detection and rapidly responded, whereas other countries continued to watch and to wait and not really to respond when they did see that there might be disease coming in. We know, for example, in the US that there were infections in January, yet response didn't start in January, and it's not clear whether they were just not identified or whether they were identified but not causing great concern. So again, best practice in one country may be different than another, even at the very beginning of an outbreak. So it's very hard to make a generalization on best practice, except that all countries should be on the alert, ready to detect rapidly and respond rapidly when they do find an outbreak, and not try to blame it on others and on failed global mechanisms, because it's really the responsibility of every government to develop the capacity in their countries to detect and respond where and when diseases are occurring.
Thank you very much. Very clear. So, Jennifer, any comments on that from your end?
I completely agree with what David just said. And, I think it is important for us to, first of all, have a vision of how this is going to unfold. And I'm very heartened by David's vision for it. I share it. I know not everybody does. And I think there is potentially still a push in a view that we can eliminate this virus. I don't share it, but I think that we need a global vision of how this is going to play out in the coming months. But I also very much support his comments about the fact that this was something that individual countries failed to do for their own selves. And, I can offer an example. In February, I was in a meeting in the United States with some state health officials asking about their plans to deal with the virus. And these were not, these were sophisticated people who generally pursue public health endeavors, with success. But they hadn't actually started thinking about it. And, in part because we had been talking so much about the travel restrictions that the political leadership in the states where these health officials were working were convinced that this virus was a problem over there. I mean, that was the phrase that they used. And so it hadn't really occurred to them that aside from the one-off cases that would be, detected in a traveler here and there, that it would take root domestically. And so I really think that was a failure of communication from our political leadership to health officials. I also think, to borrow a phrase from our debriefing of the 9/11 events, the 9/11 Commission used the term a failure of imagination. I mean, I do think that there was a lack of understanding of how respiratory viruses typically spread and the difficulty of catching them and keeping them out at borders if you are not in Australia or in New Zealand. And especially given how late the United States was to even implement travel restrictions in the first place. I do think that that was a big part of why the response didn't happen. We just got a late start. Whatever time we may have gained through travel restrictions, and I don't believe that it really gained us time. I think it just masked what was happening domestically in the sense that we were only testing people.
Thank you very much. Sorry, we are running out of time. So may I cut off here? So another point I would have to raise is, as pointed out by Oshitani-san already, and this is a question of international cooperation. So What I mean is that why is it that the international community failed to cooperate? So WHO as a technical agency could not really function very well. That's been pointed out already. But on the other hand, we have the United Nations where member countries are supposed to work together. And we have this international cooperation system called the United Nations, but even that didn't work. And in the background, there is a division and confrontation among different countries, and those are leader-type countries are suffering most from this infectious disease, which means that the leadership, no country can play a leadership role. There is a kind of vacuum of leadership.
So what do you think about this? How can we improve that to prepare ourselves for the next pandemic? And because of the time limitation, please be brief, starting with Oshitani-san.
Okay, thank you very much. This pandemic occurred unexpectedly. And no country was expecting for this kind of pandemic to occur. And that's why there is no global solidarity. But we have to remember that now the more than 120 million cases have been reported globally. Johns Hopkins is doing a great job in counting the number of the cases. This is because the WHO and also the high-income countries, particularly US, provided a lot of the financial and the technical support to the low and middle-income countries in the past 20 or so years. And we have to remember this. And after this pandemic, or even during this pandemic, we need to discuss how we can work together again. And I'm still optimistic that we can rebuild the global solidarity. And that's what we've been doing in the past 20 years, at least before this pandemic. And then we have to rebuild the mutual trust and the global solidarity. Thank you.
Hi, Heymann-san.
Thank you. So Mr. Heymann, please.
You know, I think that in order to have global solidarity, we need to make sure that we can decrease the political input to our international organizations as much as possible. One way to do that may be to have a one-term director general at WHO who has a term of 7 years with no possibility of re-election. That would help to decrease political influence on the director general, which is very difficult for a director general to ignore. So maybe we as a global community need to be thinking, how can we decrease the politics which do play out in the political bodies of our international organizations, such as the World Health Assembly? Just one possibility moving forward, but I think it's as much the responsibility of member countries of the international organizations as the organizations themselves to begin to decrease opportunities for political influence. I'm not saying that that's occurring. I'm just saying that what we need to do is decrease the opportunities for it to occur. Thank you.
Thank you very much. So Dr. Zheng from China, one word. So what should we do is my question.
Yes, I agree with David's point, but also I would like to add that we really need to also strengthen the regional office and also regional collaboration. This is really important, for example, in Asia and Asia, and also 10+3, and also well, this is something that we have advised that the Chinese government to really take serious about the potentially create an Asia CDC type of a system to allow regional collaboration and strengthen regional system. So in addition to headquarter and the global collaboration.
Thank you. So, Jennifer, so your thought.
I think I'll add that there are places where there are obvious opportunities for global partnership, where collective work makes us stronger than individual work. And I think promoting those as a path to solidarity may be useful. One is around developing data standards, how countries relay information about cases, how they relay information about deaths, understanding that there are different approaches and how they find them internally, but just so that we can get a more commonly, more comparable picture of what's happening in countries when we have this need for a global picture. Countries clearly need information about what's going on elsewhere, and so perhaps there'll be some agreement on doing that. I also think that the ACT Accelerator has really demonstrated value in the development of medical countermeasures, and hope that that can be built upon in future events. And I do think COVAX is an important development. I think ultimately we will continue to see its importance as this pandemic unfolds, and expecting that no country is going to be able to escape it fully. I think the value of having shared resources will become even more clear. And so I think promoting those three areas in particular is useful for building that solidarity.
Thank you very much. And because of lack of time, we still have 4 and 5 minutes, so I cannot ask you any further. But let me give you one last question for you to answer. Finally, it's kind of odd to talk about the next event because we are still in the midst of this pandemic. But if the pandemic hits again, are we going to repeat the same failures? What is your thought right now? And if we can change just one thing so that we can have a different response, what do you think should be done? Starting with the Oshitani-san, within 1 minute, please.
I'm quite sure that we are going to have another pandemic in near future, and we have to be prepared for the next pandemic, and we should have a better system. And we have to work together, and we have to strengthen WHO capacity. I still believe that the WHO is the only the global body in coordinating the global response, and we have to strengthen WHO capacity, and we have to realize the importance of the WHO role in the global response to any international issue, including the pandemic. Thank you.
Thank you very much. Next, David Heymann, the last words in 1 minute.
Yes, I'd just like to emphasize 2 points. I think Zheng is absolutely right that what we need to do is concentrate more on regional solidarity along with that global solidarity. So any regional institutions that can be strengthened should be strengthened moving forward. And the second thing is that we shouldn't forget that the best way to deal with infectious diseases is national capacity. And we need to make sure that countries meet the IHR standards for public health, but in addition that they understand that preparedness also includes robust health systems, which will not collapse, and healthy populations that will not be susceptible, such as unhealthy populations are to the current pandemic. Thank you.
Thank you very much. So Dr. Zheng, 1 minute.
Well, certainly from Chinese experience that after SARS outbreak, Chinese government has invested heavily on strengthening the system. And in many ways, I think that the system really works is much better than we see 17 years ago. So I'm very hopeful that with optimistic, so certainly with caution, and whether when the new pandemic will repeat it, we'll see the repeat problem again. But certainly, I hope that the global community can learn from this pandemic and really move forward with a very strong will and to do better.
はい。ありがとうございました。じゃあ、
Thank you very much. So, Jennifer, you're the last one to speak. So, please give us the last words.
I am hopeful that we will learn from this event, and I do anticipate that we will have to use those lessons at some point in the near future. My hope is that we don't build now a COVID preparedness plan. I think we were faced a shortcoming from the fact that most of our preparedness pandemic plans were influenza specific, but that we have broader based plans that can respond to a range of infectious disease threats. And I think the key area of greatest need is strengthening health systems so that they don't collapse, as David said.
はい。はい、どうも。
Thank you very much.
このセッションがこんな短く感じたことはない。
So this session felt so short while it was in a 1.5 session. I would have wanted to ask much more questions. This topic of this session was set up deliberately very provocative. Why the world mishandled? That was the theme. I wanted to raise this way the problem in order to wrap up the comprehensive view of this pandemic, in order to draw lessons for the next and the future. And you gave us a lot of ideas, clues, but it's not enough at all. This is my feeling. I would like to continue to have this type of discussions continuously across the world, and I would urge you to do the same, so that then we will be able to together create a mechanism which will prevent for such a pandemic to happen again. Thank you very much for staying us to the end. Thank you very much. This is the end of the final session, session 3, COVID-19. Why did the world mishandle its response to the coronavirus crisis? The final program is the closing remarks, so please stay with us for a few more minutes. And there are some apologies I have to make. Mr. Hassan, Mr. Hinton, and Mr. Carlos, Mr. James Lindsay are being showed on the screen currently. If you are still staying with us, please turn your video on for this final closing remark session, because you are representing the 10 countries, 10 think tanks who have been joining us from the beginning of this Tokyo conference. So if you could turn your video on for the final wrap-up session, closing remark session, I would have highly appreciated. Thank you very much. Over 2 days, starting from yesterday, I really enjoyed this rich discussion with all of you. Those who have been listening to our discussions, I am sure so amazed to see us being so seriously discussing the democracy and the international cooperation. Of course, the Biden administration, one of the reasons for us facing all these issues, but and discussing these issues, but it is not the only reason. How we believe and consider democracy and international cooperation is, of course, related to how we think about the Biden and the U.S. administration, but it is still an independent, separate discussion that we consider as a discussion item per se. And then globalization and how to reconsider it in the context of democracy and international cooperation, that was discussed by us this time. And also when China is filling a lot of gaps, and how we will be able to create an eventual final consensus across the world. That was also covered by our discussion. And the UN system,
was mentioned, how UN system can function in the middle of a conflict between nations. I deeply thought about that, but I think in the final analysis, democracy is an issue for each individual person because we are the sovereigns. We as sovereigns, we need to be committed to democracy for democracy to be successful and prosperous. It does not exist in any autocratic countries. We in democratic countries are sovereign, so we have to squarely address the issues and challenges of democracies, and then we have to make it happen globally so that the UN system will be able to truly function. We should just not leave to others the global governance. We have to act ourselves. I think we had this very important realization with the COVID-19 pandemic this time around. I do not want to criticize too much, but in Japan, many people think that we ourselves have to protect our own lives, and that restrains a lot of activities under the theme of the so-called self-restrictions. But it also pose a very important question of the role to be played by the government. And the changes that we are observing currently are really, in my view, historical changes. We really have to squarely face them. And the Tokyo conference was launched from the beginning in order to face those crucial changes. And I feel so encouraged that I am being accompanied by all my fellow participants, and then we are so exhausted. Here in Japan, we are in the late night and toward the end of this conference. But then, thank you very much for staying at Mr. Lindsay, Mr. Rohinton, and all others. We have been having these dialogues with all of you because we want to squarely face the challenges and facing the world and the multilateral cooperation, international cooperation, multilateralism, and democracy. We would like to make them develop, and currently we would like to really repair them. So we really hope to continue this discussion. Please continue to join us. And the topics of the discussions every year will be ever more stimulating. And we would like to make our discussions ever more exciting every single year. And then we spent 48 hours, and it was being so exhausting, most exhausting of the discussions that I experienced. But I hope that you enjoyed, and it was rich for you. And thank you very much for the audience staying with us to the end. And I also thank many staff members who are working here in person with me in this venue. Thank you very much. This is the close of the Tokyo Conference 2021. Let's see us again in 2022 in Tokyo in person over sake. Thank you very much. We will be able to have this conference again in person in Tokyo. So let's see all together in Tokyo next year.